Everyone good? Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I welcome you to today's afternoon media briefing. And while we're very hopeful and optimistic and spring is in the air, we have to remind everyone that the pandemic is not over yet. So today, kind of the remarks will be wash up, mask up, back up, and vax up. You've heard those terms before, but we need to remember that we are fighting this pandemic on multiple fronts. So even as we're optimistic and hopeful, today we're reporting 48 new cases in individuals aged 1 year to 89 years. I can't help but remind us every time that we do that there is no age restriction on this. This pandemic knows no age boundaries. And our positivity rate is increasing at 3.6%. And we've also seen an increase in the number of individuals who have been hospitalized with COVID-19 over the past 2 weeks in the region. But on a more positive note, 98% recover, and there have been no additional deaths to report. But we are adding 2 new locations of concern for the week, Rosecrans Griffin Williamson, a Rosecrans Ware Center. But one location of concern has completed 2 incubation periods with no new cases and is coming off of our watch list, which is the Winnebago County Jail. So I want to keep those numbers in mind as we work through some of this discussion today. So when we talk about fighting the pandemic on multiple fronts, we still have to follow the social mitigation strategies. Masking when outside of your household, being selective when you're with vaccinated individuals, maintaining social distancing of 6 feet, avoiding crowds. I know this is hard when we see the pictures coming out of spring break out of Miami and Florida and Mexico, and I come back to that certainly is not avoiding a crowd. Isolate promptly if you become ill with signs and symptoms of COVID-19. And you have to continue to monitor yourself for COVID-19. This pandemic is still around, and I'm amazed at the number of people who said, I didn't think it was anything, and I came into work. We know that that's an exposure that can happen. Quarantining. People have been kind of loose on quarantining. If you've been in close contact with someone who has tested positive for COVID-19, you need to quarantine. And currently the CDC recommendation is, regardless of vaccination status, if you have traveled, you must quarantine. Wherever possible, move outdoors. Thank goodness spring is in the air here because we're beginning to be able to move more things outdoors. Open windows to increase fresh air exchanges and increase your air exchanges as much as possible in an indoor ventilation systems. And of course, we continue to talk about washing hands frequently or sanitizing frequently with alcohol-based rub. So those social mitigation strategies, we still need to be practicing them. Testing. Continue to seek testing if you've been exposed or developed signs and symptoms of COVID-19. I know that you all understand that the lowering of the number of tests that are being conducted increases your positivity rate with number of positive, but the bottom line is if you're symptomatic, you still need to test. We know the testing site at Sandy Hollow, outside in the parking lot, they are Monday, Wednesday, Fridays, and Saturdays, and that really was driven by demand for testing. But it becomes important, if you need to test, please go and get tested. I think the other part that we probably haven't messaged enough about when I talked about those hospitalization numbers is if you test positive, contact your healthcare provider about receiving treatment to decrease the risk of hospitalization and death. I think we've done focusing a lot on social mitigation. We talk a lot about vaccination, but we don't always talk about the infusion therapies that will help reduce the risk. But if you're in the hospital or already on oxygen, it won't be beneficial. You need to test 1 to 3 days before you travel and 3 to 5 days after you travel. So be thoughtful about as you prepare for your spring break. And I know we're all kind of wanting some warmer weather, as we know, but be thoughtful about that. And when we talk about the treatment therapies, it is beneficial for mild to moderate cases of COVID-19 and high-risk individuals. So if you test positive and you meet any of these risk criteria, contact your physician immediately, because it may take a while for those test results to filter to your private providers. That includes things like obesity, chronic kidney disease, diabetes, immunosuppressive diseases. If you're taking medications to suppress your immune system, If you're 65 years of age and older, or you're less than 65 with conditions like heart disease, blood, or lung disease, those become conditions that if you can get into therapy and treatment sooner, we can reduce the risk of you needing to be hospitalized for COVID-19 infection, and or worse, we can potentially prevent your death. Contact tracing. I know we've talked a lot about vaccination, but our contact tracing team is still on the call every day during the week. Remember to answer the call from the contact tracing team. I remind everyone to provide accurate and truthful information to protect the health of others. I'm amazed at the number of individuals who have the infection and said, I work from home and I haven't been out. So how did the infection come to you then? We have to be, we've got to protect each other on this. We've got to quarantine your household contacts and your close contacts. Those people you've been in less than, 6 feet of social distance. It might be riding in a car to go to lunch together. It might have been an event or maybe a small intimate gathering. But the important thing is to know that and to share that, because we've got to protect the health of each other during this time frame. And follow the directions of the contact tracer regarding isolation. Again, it never ceases to amaze me the number of individuals said, well, I thought it was a recommendation and not a requirement. The order to isolate is an order to isolate, and you need to follow that direction. But let the contact tracer know if you need resources to help you isolate or quarantine. If there's an issue that you have, whether it's, rental assistance, whether it's food assistance, whether it's telephone assistance, whether it's getting, your kids to and hotline if you are an individual that needs telephone assistance. And they have a listing of multiple sites and locations. Winnebago County, obviously we focus on Winnebago County, but we've talked about before, register on as many sites as you can, whether it's Walgreens and Myers and Hy-Vee, the private pharmacies or retail. If your health system provider reaches out to you and says, today's your day, can you vaccinate with us? Go and take the first available appointment. We are outrunning these variants, and we need to continue to do everything we can to vaccinate ahead of that so we can protect our community and those who cannot be vaccinated at this time. All 3 vaccines are effective at preventing hospitalizations and death. I know that we've talked a little bit about, not having choices, but try not to vaccine shop. I have individuals that are, coming to a clinic and saying, if you don't have that kind, I don't want it. That dose had your name on it for that clinic. And we are doing everything we can to provide you with effective and safe vaccines to protect you as promptly as possible. And if you need a second dose based on the type you received, you should be receiving your second dose from the same provider. We are already seeing some concerns with individuals receiving vaccine of one type for the first dose and getting a second dose of another type. These vaccines are not authorized for that, and we don't know the safety and efficacy profile of mixing vaccine types. So while you may think you know, and you may think you remember which vaccine type you had, if you got Moderna on the first dose, you need Moderna on the second. If you got Pfizer on the first, you need Pfizer on the second. If you get the Janssen product, you only need one. So don't go and get a second dose anyplace else. But I think the other problem that we're seeing a lot is those lost cards. Please treat your vaccine record card as if you would a passport, a driver's license, or your Social Security. The number of individuals who are telling us that they've lost their cards, that they've misplaced them, that they ran them through the washing machine. At this time, we are not authorized to reissue cards. They are your identification that you've been vaccinated and received your full vaccination series. I also want to caution against lamination. We've heard individuals laminating cards where the stickers have heat treated and come off of the card. And again, we cannot tell from that then what vaccinations you received and the dates and the lot numbers you received. So please treat these and guard these very carefully. Take a picture with your phone. If you are through the Qualtrics site, you will receive an electronic verification. That's kind of your electronic passport that will store it for you, but also, again, take a picture of it. But try to remember that these are things that we cannot replace easily. And we've got to spend more of our time vaccinating rather than worrying about replacement cards or figuring out where you got your first or second dose. So work with us on this so we can get more of our population vaccinated. Reminder again, when we schedule your appointment and you say you're coming, we've got your name on that dose. And someone else is waiting in line. So if you can cancel, if you can let your provider know, if you're not going to come, I know people are worried about, well, I'll just come here and then I'll just go there and maybe that's not a problem. The challenge that we have is that that's one other person that's waiting in line that couldn't get it today. So whatever we can do to convey to our friends, neighbors, relatives, take the first available, get it done, go back for your second because that dose has your name on it. You need to wait for 2 weeks after completion of the vaccine series. So if it's either Pfizer or Moderna, we talk about that 2 weeks afterwards before you're considered protected as the full efficacy of the vaccine. So oftentimes I hear, well, you know, a couple days after, you're still going to have to quarantine until you're fully protected if you are identified as a close contact. Vaccination efforts continue from a multiple variety of sources. Through the health department, we continue our community-based vaccination site at Sandy Hollow. Our mobile sites for essential and frontline workers based on the phase, and we're going to talk a little bit more about that. And of course, we are starting up next week the new Zion Missionary Baptist Church location, which will be another site in Winnebago County. So we learned also this week on some more positives, which you're probably, if you're watching from home, you'll probably get to see some of our media. We got some new essential workers became eligible for vaccinations on March 22nd. This included our court system and other government workers so that they will be receiving vaccinations. Staff that work in higher education, including career colleges, trade colleges, community colleges and universities, but not students. So those are for the staff, the faculty, the adjuncts that all work in those locations. And today, media also became eligible as of March 22nd. So today we are going to ask several of our media outlets have identified staff that have willing to step up and receive vaccination, and maybe tell a little bit about why they are choosing to be vaccinated today. From WREX, we have Derek Bain. From WIFR, we have Zoe Chapala. From WTVO, we have Dylan Siraki. And from the Rockford Register-Star, we have Scott Yates and Chris Green. So we appreciate for them stepping up and telling a little bit about their story. They've been waiting patiently for it to be the essential workers that have been out on doing the media stories throughout all of this to wait for their turn in their phase.